wasn't ready. Like they're like, oh, why don't we start on Monday? And I just wasn't mentally prepared for that. But I know they need people bad.
Yeah, you have a shot of the ceiling.
Super interesting.
Oh, it's 80%. Like, oh, what?
See,
100%.
Because it jumps. Yeah.
Because look, I'm not gonna. You better shape up, or I'm not gonna measure. Oh, and there's. Oh,
well, yeah, but
Krista's in.
But it might do another one when you're done.
That's true.
Sometimes it does that.
Hi, Krista. No, are you there?
Krista, wasn't she here this morning?
Yeah. Well, look at you.
Yeah, you know what? Hi, Julie.
Oh, hang on. Go ahead. I'm sorry. What?
We're driving home from the burbs, and I thought since I enjoyed this morning's class so much, I wanted to see what you're going to do tonight. Can you hear me? Can you hear me?
Well,
She can't hear me.
oh, see, look at that. It's
because this is eating up your bandwidth.
oh. Just hang in there, Krista.
You can do a chat too.
We have the media kicking on the phone part.
Hold up, my computer's updating.
Maybe that's why I can't talk.
It's the video's fine. I can hear her. They just can't hear me. I don't want my video.
Oh, there we go.
This guy, this ain't good.
So how do I let her know that I can hear
I can hear you. I can hear
Oh, okay. You can hear us? You can hear me?
And just so you know, and it's going to be, I'm hoping it's going to work, but I don't know. So my old computer that I was using decided it wanted to do an update. So I'm hoping it gets done in time. Otherwise, I'm on my other computer, which is not exactly, that was the one that was unstable. So it does.
That's okay. I'm just sitting here in traffic. My husband's driving, so I'm just trying. I thought I would try to.
I'll let you know. I mean,
catch
so that,
anything new.
oh, I'm sorry. I actually wanted you to be face down.
I figured.
So I put Stephanie on the table, but I'm just adjusting. We're adjusting with the, if you want to go ahead, just, you got enough sheet. We're not starting yet, so. There we go. Do this. You probably want your arms under because it's chilly. I'm going to guess. And then I'll put this other one now that it's on the floor on top of you for weight.
Oh, did you bring your weighted? Oh, no, you didn't.
No, I haven't been using that.
Oh.
But
Because it makes it too warm, or?
I usually don't use it in the summertime. But I've actually been thinking about it now that it's like the weather has slightly shifted. But it's still, I'm guessing it's still hot out today. Well, I haven't been, I'm freezing in here today. So.
Oh, do you like it?
I
It's too hot for me.
And you don't have to put your face in there. You can have it to the side. You don't, I mean, save your face. That doesn't even make sense. Uh-oh. Oh, no, that's Krista. I'm sorry. Oh.
Yeah,
Come on, computer.
If my boyfriend would have it, I would live in Florida, but he won't.
Oh, really? That's humid there, too, though.
I'm cool with it. I love it.
Oh, I am a
Hi,
crazy
Laura.
bitch.
Wow, that's really. Hi. We're working on waiting on people to connect, so we'll hang out for a moment. I know you can't. I kind of look funny because I'm standing here. I'm standing like right in the view. And there's Amy. Hi, Amy. Oh, there you are. Hi.
Hi, Julie.
Hello. I'm going to tell you guys just in case, I'm on my Google computer, my Chromebooks, which Zoom doesn't always love, but I have my other computer. It just decided to do an update. So I'm hoping I can try to connect with that one and then get rid of this one. We'll see. I think that'll work, but we should. Michelle is the one I don't know if Michelle is coming in person or if she's dialing in, but either way, it's only 6:01. So
I thought she was.
Is that a body on there?
there is a body. Yes. So Nicole is here, but Stephanie is on the table, in the prone position.
You guys.
So, oh, here, there's the body.
Hi, there she is.
Hi, Stephanie.
So while we're waiting a few minutes on Michelle here, so I did go ahead and ask Stephanie if she had any area that was bothering her, any pain, discomfort, that type of thing. She said that occasionally she has an area on the medial border of your right scapula
Yeah.
that sometimes causes her a little restriction, discomfort, but it's not hurting right now because she got work done on Monday. So I know Krista, you were here this morning. Nicole, you were here this morning. The recording will come later. Cameo had some pain that she was dealing with, so we did an assessment before we did our massage. Stephanie's not broken, so
Yeah.
I
So
mean,
this will be much faster.
so well, who knows? We'll see what happens.
Fine.
Yeah. Oh, and there's Michelle. Sorry, I like get so close. It's like, ugh. Hi, Michelle. Oh, no, wait. I don't know if she's there yet.
I'm here. Can you hear me?
Oh, yay. Hi.
I have a leaky tire that needs to get fixed, so I didn't come to class. I was planning on coming in there tonight.
Okay. Yeah, flat tires are not something that we
No, I was a little nervous to drive an hour. So.
Oh, yeah. Where do you come? What area do you come from?
Mundelein, so it's almost an hour to get there.
I don't really,
Yes.
I mean, I've heard of it. I don't know where it is.
Yeah, it's nothing special.
Ugh. Yeah, I'm hoping this. My old computer has decided, probably because it's plugged in and I have Wi-Fi, that it wants to do an update. So I'm hopeful.
I can't hear you.
I know.
Oh, now I hear you.
Yeah. We might wait until my old computer is done with its update so that we don't have this problem. How do I make it go faster? Yeah, because they're
I
frozen.
mean, like, I know it says not to turn it off, but that's so.
I tried.
But what if you no?
Maybe if I unplug it, it'll.
I wouldn't. I would just keep it going
Really?
since it's like,
Well, it says,
Over
don't
halfway
turn off
through.
your PC. This will take a while.
yeah.
Are you guys back? I'm done yet? Yeah, I'm sorry. I didn't plan on that one. So maybe we'll go ahead and start, but then even the recording is going to be awful.
Yeah, it is.
So,
Why don't you start and I'll keep an eye on this and we can start recording on that as soon as it.
What is it at right now?
0.
But it's
Percent.
run.
Well, Julie, for me, it's like, don't worry, don't stress. If it freezes, we wait a minute, no big deal.
I'm shutting it off. I'm waiting 10 seconds and I'll turn it back on. Maybe that will magically fix it. I don't know.
I'm not going to hold my breath on
Hey, now.
that one.
And it worked so smooth and good this morning.
It did work well this
I
time.
had it all set up. I went to the bathroom. I came back and it was doing an update. So, I mean, but I just shut it off. I'm waiting to see if it goes. I'm working on it. I wish there was a way to move his laptop, or not laptop, his
We can just move the table over there.
Actually, I wonder if that would work.
Well, we wouldn't be
We can
able
s-
to.
we would be able to.
remove the camera.
Hang on, I know this is really boring.
It's okay. Julie, tell us a story.
The control alt
Anything.
delete. Am I frozen for you guys, or Amy, are you live? Yep. Okay, you're moving. Well, if so Nicole, I know you can do two things at once. So as you're watching, so like Amy will, like, she puts up her arms when she can't hear something.
Just
Or
keep
it
an eye
might
on
come
it.
across
Your
and
thing is
say
doing something over there.
it might come across and say it's unstable.
Uh-huh.
Because then we want to pause and wait. Hang on, my computer might be doing something, and then we'll just get started because best laid plans. Darn it. Let me get my coconut oil. Well, all right. All right, we're just gonna start because
You want me to move the thing down there? Or you're gonna do your back?
yeah. Okay, so my client is in the prone position. Once you put your face in the face cradle, tell me if it feels like it's adjusted correctly. Does it need to go up or down, or does it feel equal pressure between your cheeks and your forehead?
It's fine.
Yeah, you're not going to be able to breathe with your mask on.
Yes.
Okay, I'm just going to move the last of your hair out of the way. I did, when she laid down on the table,
Are you recording?
it is automatically recording. I set it up that way. So I didn't have to remember to press the button. I did make sure that nothing was tucked under her. So I untucked everything. I know you guys didn't see me do that, but I did do that because I always make sure of that. So again, she doesn't have any particular discomfort problems at this point. And right on the sacrum. This morning they asked about weight. So it's more than just the weight of my hand, but barely. And I do this to start to calm her nervous system, and not that her nervous system is overactive, but I do it on everybody anyway. And then I start to always move my hand on the sacrum because I know that's where the bundle of nerves is coming out. And then I'm going to move into, yeah, I think you can see it. So I'm just going to go side to side from the sacrum over the top of the posterior iliac crest. The pressure, I suppose, is maybe a 1. It's more going to do it this time. Sometimes I focus in on feeling the sacrum. I did not do it on our client this morning because this is the area that she had pain. So I'm just feeling around the bone. I want to find the center, the outside, or each border of it, just because I can. Occasionally, Stephanie, I will ask for words. So, but maybe not. All right, and I'm gonna work down towards the leg, so I'll probably need, maybe, I think, and it, actually, didn't we, how did we do that this
We
morning?
went down
We
there.
changed. Sorry, rolling cart. Yeah, I just gotta change the angle a little bit. That's like a lovely view. Hi. Okay. So I have on a sheet, a blanket, and then a towel for a little bit of weight on the leg. I mean, on the entire body. I know my hands are probably cold, and I apologize. So you guys have probably seen me do this before. So I just lift it, shake it. It is Traeger, but I'm also, she's helping a little, but I want her leg to hang off, her foot to hang off. The majority of clients I can do this with, maybe 1 out of 100, their leg won't actually come to the outside. There's too much tension in it. But
Would you use a bolster then?
I needs to be added because she's having discomfort. So were you having any discomfort?
No.
Because it's actually hard to talk and massage, as you guys know. So I'm just putting on the oil now. And I am using my hands, but I'll be switching. So you guys didn't see me wash my hands and my forearms, but I did. So for this, I don't have my glasses. I do have my glasses on. That's why everything is blurry. I'm like, I can't see things. So when I put my foot on her shoulder, I want to make sure that I'm not pushing her toes up into plantar flexion. So I do have to bend down a lot because this table is low. I'm used to the automatic one. So I'm just going to move from my hands to my forearm. I don't know if they can see. Actually, maybe put the camera by like where you are. I'm not sure.
Julie, is there a reason why you use coconut oil?
Because I like it.
Okay.
Years ago, I had an introductory Lomi Lomi class, and that's what she used, and I just fell in love with it. I don't even have anything else. That's all I've used for years. It's it. I can add a drop of smell to it if I want to, but I rarely do that. It's not greasy. It's got good flow to it. Just my preference. I don't like lotions at all. I've tried gels. When I do some of my continuing education classes, I'll have people bring whatever they're using, and they're massage therapists. And so I have tried other stuff. Just, it doesn't do it for me. So I started doing stuff and I wasn't talking, but so I do like this side angle work with the lower leg, just kind of sawing it into maybe thirds. I don't really count, but I think of it that way. And then I do the same thing as I go up. I do like a center stroke with my forearm, and then up on the outside. I'm not on the lateral part. I'm on the hamstring. That's where my pressure is. And as you can see, I'm doing something different with each forearm because I'm trying to decide which one I want to bring up to the origin of hamstring. Because it's not always going to be my right arm and it's not always going to be my left arm. She doesn't know that that's what I'm doing, but I'm
You're-
trying to decide.
You're looking for which side has more tension, or what are you
No,
looking for?
I'm looking for which one of my forearms is going to fit better.
Okay.
Because I want to hold pressure. So I'm using my ulna so it's more narrow. And maybe you can see and maybe you can't see. And I'm doing this to give broader pressure and then narrower pressure. How does that feel, Stephanie? Awesome. And I'm gonna do a little frog leg thing. I usually add my knee in to hold the leg in the position. My fingers are taking her gastrocnemius and soleus off of the fibula bone. And then I'm gonna go under. It was kind of comical this morning because you guys will see how often I work with the hamstrings, which is a lot.
This is finished over here.
I don't know if you could figure out how to get. Oh. I don't even know. She thought the old computer came back up, but it might not have. So I'm putting both hands underneath to get the adductors, pressing my hands down on her hamstring. I can pull up, I can push down, I can do a combination, kind of a ringing effect on both at the same time. I'm going to shake it out a little bit. And then you can bring the heel towards the sacrum. Some people do this as a little extra stretch. It's something that you can do. If I would have her arm hanging off the side of the table, which I don't because her arm wasn't in the way, I can add in her scapula pushing up at the same time. So there's different things that you can add in. But before I work on the glute, I want to position the leg back to neutral. I'm going to keep the leg exposed because I'll do a lovely little thing at the end. So I did get to origin of hamstring. So right now I'm pressing in, I am using my thumbs, but I'm just trying to feel the bone. It's just seeing where her bones are because I want to add my forearm in. So I'm pressing down into her glute, but my intention is to move it to the opposite shoulder. Words, Stephanie? A lot of pressure, a little pressure. How's it feel?
It's perfect. I mean, like, you don't need to go deeper. You don't need to lay it off. Like, it's perfect.
So I push down and in. I do a little roll. I back off a little because as her glutes change, I want to allow it to change and then I want to go back in.
So when you're going back in, you're putting the same amount of pressure on or less?
I'm trying to stay equal.
Okay.
Because she's happy with the pressure. So if I add more, I don't want her to be like, oh, that really hurts. But I am getting to the bone. So I'm going greater trochanter and I'm trying to get over to the border of the sacrum. That's my hope. As it feels like I've increased pressure.
It does a little bit, but not in a bad way.
My computer is still popping things up. So now I'm on the posterior iliac crest. I am using my thumbs to find the outline of the bone, even though she doesn't have like large glutes, but I still want to make sure I'm not pushing on the bone. And I'm not sure if my forearm's going to fit in there, but we're going to try it. I want to be careful not to use my pointy elbow on her glute because that's never for me. That's me. Yeah, I already have thoughts of what I'm going to do on her back. It'll be fun. Something totally different than what I did this morning. It's nice when you have a client that isn't having pain or discomfort, but that doesn't mean you're not going to find something. So, pardon me while I move on. All right, and hopefully you guys can stay where you're at with that. We'll see. I might have to adjust it. There we go. So I just uncover. This helps us know if she's helping, if she's relaxed. And then I can get her foot to be off the table because that's what I want anyway. So I'll do on this side. Yeah, I think you guys can see it. So sometimes people's fingers are right on the side of their leg. Just depends on the length of their arms. So this is how I deal with that because I don't want to hit her hand. I reach under, I find the inside of her elbow, and I'm moving and kind of shaking her shoulder joint out. And then I'm just going to let her arm hang. Usually I try to cover it back up. Hopefully there's enough sheet. So just putting on the oil. I'm not like a tucker fidgeter, but what I will do is as I'm doing this, I might move it, put it where I want it. So I'm trying to do like two things at once. After I get the oil on her leg, and I know it might not be as smooth, but I have to put it on my forearms. So there's not a great way to do that. So I do stop for that, but hopefully she forgets about it when I do this part. So it's still the same purpose of trying to pull.
I don't think they can really see anything.
Okay, sure. Yeah, I didn't know. Yeah. They can see like my black shirt.
Yeah.
Okay, thanks. Thanks, Nicole.
You're welcome.
She's a good camera girl.
I try.
So with my forearm, I'm doing the same thing as what I'm doing here. Just getting my fingers to find the bone and pull the muscle up away from the bone because I'm going against gravity. You can use your fingers on the outside to do the same thing. You can use your thumb, but you know, we like to reserve our thumbs. Once I do that, in no particular counted number. I'll go in the center with my forearm. Then I'm doing that side seesawing. I'm feeling the bone. So it's my forearm bone to her leg bone. Pressure wise, what does that feel like, Stephanie?
It's really awesome.
So you notice I was like touching because I don't want to go under, but I don't want to expose too much. And even I've told you guys before, regardless of what they're wearing, I personally am not going to expose the glutes, not for any reason other than comfort of the client. But that's me. And I feel like I should be able to do my work on top of the blanket sheet, shorts, pants, whatever they have. So if you notice, I'm doing like from my extensor side to my flexor side. Hopefully you guys can see that. So I'm just like rolling up and down. All I'm doing is trying to see which forearm is feeling right on her leg. I'm in a lunge. I'm making sure that my pelvis is not twisted. My wrist and my hand are relaxed. Nicole's probably like, I don't want it. I want to feel it on my leg. She watched this morning, and Krista did too.
I don't like my legs.
You don't like your legs touched? Man, we got to work on you next week then.
I'm sure I'm a mess.
So then I'm going to do a little frog leg, add my leg in. Going to go back to pull the muscle off the bone, but it changes it because of gravity. Then I'm going to pull underneath, the same thing. I'm feeling the bone and just pulling or like peeling the muscle away. I usually do it a little fast. It can go fast or slow. So now I want to focus on the hamstring part. So I have to bend my body so that I am not hitting right on the angle where vastus lateralis and hamstring meet. It's very prominent, but it's painful. So I don't want to be right on that edge. I'm going to be in the juicy hamstring. So I have to bend more to hit the hamstring in a different angle. I can do the same thing that I did on the other side. I'm pushing down. It's a kneading. I can pull up. I'm more on adductors than hamstring, but they all of it needs it. So now I'm doing a butterfly stroke, separating. I actually can get quad because I'm right there to do it. Any complaints from the client?
No.
If you have,
I can't wait to watch this video and see what you're doing.
so now I'm going to put her leg, hopefully, back in a neutral position so that I can go up to the closer to where I want to be for the glutes. So I'm using my ulna, my bone, to find her bone, and I found it very easily. But I don't want to press right on her ischial tuberosity or her sit bone. I want to be right above that. So I need to find the fleshy part. Is that too much pressure?
No.
And you can turn your head to the side if you need to breathe easier. This side appears to have a little bit more cat paw thing, but I'm trying to find where my elbow is going to fit a little better. think it's here. So for whatever reason, this side, my elbow forearm fit a heck of a lot better. Could have been the angle of my body. Could be her. Don't know. Is that too much?
No.
Don't be afraid. Just be honest.
No, it's really not.
So I'm going towards ischial tuberosity and then back to the greater trochanter. So it's kind of like a seesaw effect, but at the same time, I want to push up towards her opposing shoulder. It's not much room to roll from my extensors to my flexors or from tattoo side to non-tattoo side, but I have a little bit of movement that I can do. I know you guys, oh yeah, you can see. So her foot, I should be rolling her leg bones, and that's what I'm doing. The muscles are just getting the benefit. Then we'll do that little stretch that I talked about on the other side. So I'm going to angle her heel towards her sacrum. I'm going to uncover her lateral border of her scapula. I have to get myself into a lunge because it's actually like right towards my inner elbow or my antecubical space where I'm going to hold her foot and ankle. So as I bring her heel towards her sacrum, I'm adding pressure onto the outside border or that lateral border of her scapula so that I can feel her breathing. I want to hold it for at least 3 breaths, and hopefully by the third one, she just, I don't know if you guys can see, she had a bigger exhale, and usually on the third one is when that happens. How did that stretch feel?
Good.
I'm not necessarily trying to stretch her quads, but it is doing that, but it's also getting a little pre-work on the scapula. So now I'm doing my untucking thing. I think we have to rotate the camera slightly.
Where are you going?
I'm gonna go here.
Do some oil application up here.
I'm not sure. Yeah, you'll have to see what you can. So this arm is off, and I'm gonna leave it there. Yeah. You guys say if you can't see good, please.
Is it
Please
getting
say.
too dark? I opened one of those.
I'm going to take this other arm out, put it in the same position as the other side. So you can see I only have just like from her, basically just her scapula showing, but that's how I started. I lost my oil. Not used to talking and having a camera. I would have my bed a little higher, but I'm used to working with an electric bed. So I'm just putting oil on from tricep to scapula to scapula to tricep. I might add a little more on my forearm and kind of paint it on this way. Just trying to get a little pre-done. I'd like to get it all the way over to the lateral border for the move that I'm gonna do next. Spoiler alert, we didn't do this morning. Again, I don't have anywhere to like put my oils, but we're gonna try it there. So I'm gonna take just one arm. And I'm gonna do a little Traeger to get it to hang off. I'm just checking, make sure you guys can see that. I'm gonna add just a smidgen. And I'm just gonna focus on the lateral border of the scapula. So I want to feel that lateral border. I want to feel her rib cage. I want to feel the individual ribs. So I'm moving her scapula, and I don't know if you guys can see how much the bone is moving, but it's just like playing with that lateral border. I want to push the skin down. I want to pull up on the bone, just anything that I can that's moving for subscapularis. It's moving the entire scapula. So it's an easy way to work with it. Depending on the angle of your body, you can get more side movement or you can be closer. The further I am towards her opposite side, the more traction pull it's going to give. Sometimes you want that, sometimes you don't. Then I'm going to take it and I'm going to put it palm facing up so that when I'm ready, I can work with the tricep. I'm going to go do the same thing on the other side. Sorry. Because she does have long hair, I want to be aware, I lost my oil again, that I'm not pulling on her hair. Sometimes hairs can get in the way, as we know. So I'm going to do the same thing on this side, although this scapula is different. So I'm letting both hands find the lateral border. I'm seeing how easy the bone moves. And I'm going to start a different kneading. What do you think, Stephanie? How'd that feel?
Great.
I feel like she's not going to be a real good person to say,
Ton of
yeah,
feedback.
just stop. Yeah. So once I do both sides and both triceps are up and ready, exposed for me, before I do that, because I had a good sense of where her rib cage was, I want to feel her rib cage with my hands and pull up, push both scapulas towards the center, and as a retraction. Because I'm going to go to tricep next. And the insertion of tricep on that lateral border is the best place to work with tricep. So the work that I did with her arm hanging off was actually a little bit for subscapularis, but also for tricep. So for me, I want to try to expose as much of tricep as possible. Add my forearm in. I can go forearm to forearm. You can do both arms. I can just use one if that's all it needed, or which is tension in what muscle, Nicole, just because you're here?
Is that
Oh, wait,
serratus anterior?
it is. I was gonna say, wait, I don't know if you had that chapter. She has almost equal, equal tension, excuse me, in that, almost. All right, now I'm gonna tuck her hands under. Sorry, my mask is coming
Your
loose.
tape's wearing off.
Yeah, that's because I was touching it with my oily hands. So I'm gonna pull her blanket sheet thing down a little more. I might try to tuck it a little bit, but it's gonna end up moving. So I'm gonna do this from this side for the sake, I think, of the video. So let you guys holler if you can't see. So I'm gonna put the oil on my hand and my forearm so that I can basically just lubricate up everything. And I try to just not have to stop to add more. So I want to put it all the way over on her side of her rib cage again so that she's ready for what I'm going to do next. I want to make sure that all the way down to her sacrum has oil on it. Sorry, I'm going to step in front of the camera. And then just because I'm comfortable with it, I'm going to keep my oil in this hand. I'm going to add a little bit more to my forearm. And I'm just going to kind of paint on a little bit more just to get it on that opposite side. So then hopefully I can just go right to do what I want to do without having to add more oil. It's hard because you never know whose skin is going to absorb more and less and stuff like that. So I know Mike has shown you like paint on, paint off. It's kind of what I'm doing. But I want to get down to, I'm going to section her back up. I want to focus on lumbar, then do thoracic, lower, and then thoracic upper. So I'm on her posterior iliac crest, which is for glute medius. And I'm following the bone, going right below the crest. How does that feel?
Amazing.
She's gonna run out of words. So I'm going from sacrum over.
Oh, I'm also thinking about what you're doing.
Yeah. It's not, I mean, it is relaxing, but I know when you're thinking. And then the same thing, I want to let my fingers, my hands follow her posterior iliac crest for the sake of working gluteus medius. Coming up, next chapter. And it's really just, I'm going cross fibering is what I'm doing. So that is working the pelvic crest, which is really the lumbar area. You know, you can go opposite direction of what we're used to. I'm going to trace out how far up I want to go into the thoracic. I want to stick below the scapula and above where I just worked. So for me, I literally like, okay, here's my next section. I'm like cutting it off of her body because that gives me my visual. So it's from the scapula down to the lumbar. I'm going to pull sideways. I'm trying to get my fingers in between her ribs. I'm going to kind of do a push-pull. I'm going to go over into her lamina groove. So I feel spinous process, lamina, and then the mound of her muscle. I'm pushing down and over, so from the center out. But again, I'm only working that lower thoracic. I usually divide the back up because then they can't follow what I'm doing. Their brain, I should say. So same thing. I want to find spinous process of the vertebrae down to the lamina, find the mound. I'm pressing down and just rolling my fingers over. Any words, Stephanie?
No.
Sorry, she can't, she says breathing, that's it. So when you work with the rib cage, make sure you're getting the meat, not the bone. I'm pushing down on the ribs, I'm pulling up, because again, I only want to work from the below the scapula, the center part. Finish out with a little push together and up. So it's like the opposite of a hello stroke, just going the other way, but I'm only doing a little section of it. I guess you could say it's a goodbye stroke. And I'm seeing how her scapulas are moving as I was on that mid-thoracic area. So now I'm going to focus on around the scapula, just for a quick moment. And we'll see, they have a pretty good view. So now I'm going to take my left hand, I'm going to slide it underneath the front of her upper arm. So I'm cradling her shoulder, so my fingers are on top. My other hand is going to go trace the medial border of her scapula. I can push up to make it more prominent, and putting my thumb on the outside. I think we kind of did this. We did that a little bit, but
I did it too.
so really has a lot of availability. She's got an unusual curvature of the medial border of her scapula. It starts and then it goes in and comes back out. It's unique just for Stephanie.
Special.
So with resting my forearm, it's really like I'm just leaning into the table. I'm not leaning on her. I'm not touching the table other than my forearm. And I want to get that lateral border again. And I'm going to go around this way just so that I'm not going right in front of the camera. So you guys know I try not to put the hand onto the back. This is a different version of not doing that. So I can support my body on the table. I'm not leaning on her, but then that allows me, ooh, there's a little popping.
Is that okay on your back to do that?
Yeah, because I'm not twisted. I'm trying to be straight, but I know I'm close to my work. So my pelvis is not twisted. My legs are in a lunge. And it's not uncomfortable at all. And so when I know I'm in proper alignment, my lumbar area will do like its own adjustment. I get like this little popping, which means I'm proper. So it happens when I hang upside down in my trapeze. It happens when I ride the horse. I want it to happen when I'm massaging, because if I was bracing, it wouldn't be adjusting. So it's weird, but it works for me. But you know what? Her border, her medial border of her scapula has the same shape.
I can see it when you move your hand.
Yeah.
Just where I'm sitting.
So it's a different shape, but it works.
It's an S for Stephanie.
Yeah. So the area where her scar is, oh, I can't see it in the, so I pinked up the area, reddened up the area. I was working right over where her scar was, but I couldn't even see it because of the lighting. Was that uncomfortable at all?
No.
Okay, good. I know you're getting stuffy. So I'm gonna finish out with a little bit of different type of stroke, kind of like the hello stroke, but it's gonna be with a different process because I wanna prepare her neck. So I'm lifting up, my fingers are going to find her clavicle, her SCM, and just get acquainted with them. You can add a little in and out here. Because I sectioned her back, I know I worked everything. It was just different. I know you will see some people do like this thing. That's perfectly fine, whatever. So I'm feeling her SCM and it's like falling through my fingers. I'm lifting up on it. It falls through and then I kind of press down a little bit. I'm moving her pelvic, her posterior iliac crest, like up and down, side to side. I love that. So I always try to do that. And I'm gonna cover her back up. I'm gonna go around, make sure I don't have anything tucked. The tape is gonna fall off. All right. So now we're still good. Okay, so I'm gonna have her roll over, but I'm not sure. I think, well, the camera's gonna end up going down there. So, so if you want to, and I said this morning. It depends on your client which way you want them to roll. Some people you want them to roll towards you because you're not sure that they're not going to fall off the table. Some people you feel like they should be able to figure it out. All right, so I want to make sure that your head is completely on the table. So if it feels like the top of your head is falling off, scoot down a little bit. You can do whatever you like with your arms. I didn't tell her my normal spiel when I start, which is your job is to do nothing and not help me, but I started talking and get into what you need help with. She's trying to adjust herself. All right. So I am aware that it doesn't necessarily flow. When I started with legs, went to back, got a little bit on the neck, and now I'm back at legs, but it's how it works. I'm not sure what she's got. She's really focused here on something. You're using your feet
putting
to
your
put your
mask
mask
on.
on. I'm not sure. So I'm going to do a little Traeger shaking. I'm not pulling out on the head of the femur. I'm just trying to just hold it where it is and just add a little shake. Just from the rotation, it also tells me if they're being helpful. Then I do this side to side shake, which is actually showing me the shaking of her body. Her left shoulder isn't moving as easy as her right, but her hips seem to be moving the same. I observe that because I'll come back to it later. I'm gonna get my oil. Usually I have my room a little easier for me. All right, so let's see. Yeah, Nicole's getting this now. All right, so just gonna start with adding a little.
Is this right?
Hopefully, yeah. I just if I block them, then please let me know. So hopefully there's still residual oil. That's my hope. So I'm just kind of checking that out right now. I'm going a little bit underneath because I'm going to get to that. And if she's tacky, I need to add more. So then I'm going to lift up her leg, put my forearm underneath the back of her knee. My hand is going to go on her foot. Could be heel, could be foot. And I'm going to just start by just rotating the head of the femur, medial lateral. And in the words of physical therapy, you could do a clock or a joint. So I'm going to go elbow, opposite shoulder, same side shoulder, this side elbow. And then I'm going to plant her foot and I'm going to push over. So this is so that I can expose and get hamstrings again. So I'm pushing in and up on hamstring. I'm feeling her iliotibial tract because it's, it's hard. It feels like it's bone, but it's not. I can easily feel her greater trochanter here. And I'm going to take the time to push up and then up on the back of her knee. Up on greater trochanter, up on the back of her knee. How's that one feeling? And then just roll a little bit more into the hamstring. When I put my hand underneath, I'm going to grab the sheet and put her back into a frog leg so that nothing is exposed, and that's how I do it no matter what. So now I'm going to work on the adductors and hamstrings again. So I'm going to start with this upward pull. I'm trying to curl my hands under as much of the outside of her upper leg as possible. And then I'm going to push down. So it's a little bit of kneading. Into the fleshy, the back part of the hamstring. I'm working quad, And then hamstring. I think you've done this one, right? I think, Stephanie. She might not have a brain. I don't know.
I mean, I think you've shown this before.
Okay. I didn't know. I can't remember.
Kind of.
Kinda. No. So how does it feel?
It feels really good.
So now I'm down onto the lower leg. I'm pulling the gastrocnemius off the tibia. Does that feel intense?
No, it's perfect.
And then I'm going to go underneath to get to the fibula. So I'm curling my fingers under. I find the bone and then I pull the muscle away from it. That simple. Nicole's going to fall asleep. You just know it's not gonna do it. So I want to pull up on hamstring and kind of just blend it into the quad. You can do forearm on top of the quad. But this is usually where I'm working a little bit around the knee. So I'm just feeling around the joint. Even if they don't complain of any knee discomfort, it always feels good. And I'm just going to reach down and I'm going to trigger her leg back. And then cover it back up. You to your side, I know. Stephanie's eyes are closed. I'm not sure if she's alive or not. I'm joking. It's like you want to zone out, but you can't, right? Yep, totally been there, done that. Our camera girl is working it.
Actually, maybe.
So again, just adding a little bit more. Getting underneath to hamstring, kind of doing the thing that I just ended with on there, but I'm adding the oil because I need to work with the hamstrings, and after I do this little joint movement. So then I can feel the border of where the iliotibial tract is, but I want to be under that or on the hamstring. At the same time, I'm getting to where her bony prominence is. This is coming up next chapter, so it's like a
Preview?
tease for that preview. So I'm going to find her greater trochanter. I'm going to push up to the opposite shoulder and then up on the back of her hamstring or towards the back of her knee without hurting. Is that still hamstring? And I'm going to keep the sheet, pull her leg into a nice little frog. Add my forearm, or, so on the other side, I did this first. So I'm going to do it different this time. I'm going to work towards my forearm. It's like a forearm tease where I'm like barely getting there. And just when she thinks that's what I'm going to do, I'm going to swap it. So the fleshy part of my forearm, or the flexor side, is very broad. And that usually feels better than hand. Is that what you think, Stephanie?
Yeah.
This. And it doesn't feel invasive because I'm covering a big area rather than like this, which that sometimes that's what you need to do. I'm not saying that's a bad thing, but I want to go underneath, pull up on hamstring and quad with it in this position, just because I can. I'm pushing the quad. I'm peeling it off the bone even more here. I'm gonna go down to the same thing to gastrocnemius. So when I have a 90-minute massage, which is my preferred favorite or my preferred time, I do all these same things, I just spend more time. And I look at the clock and I basically do 10 minutes on each leg in each position and probably 10 minutes on each glute because I have the time.
Wow.
And if we can get the tension to reduce in their hamstrings and glutes, then that allows me more time to work on pecs and neck. So I'm going to do this one a little different. I'm going to roll her quad from the outside to the inside. The top muscle on our quad doesn't actually touch the bone. So I'm kind of feeling for that clunking. You probably remember that, Stephanie, from that chapter. I'll work on around the knee. I am using my thumbs, I admit it, but I think this is the third time I've used them. Not with a lot of pressure because I don't have to put a lot of pressure around the knee joint. And then little trigger. Oh, there's my own. All right, so now we're gonna do a little camera adjustment.
Where are we going?
We're going up to the top. And I'm gonna take a ball. Normally I'm using a stool, but, and I think we decided that last time, if we leave it like here-ish, I think they get a pretty good view. I believe. All right,
What are we looking at?
we're looking at a body on the top. I'm gonna take
A
that-
relaxed woman.
So my goal is to get underneath to her scapula, but I was gonna say, but because she has long hair, I want to be aware that I don't want to pull that.
Sorry, Stephanie, I'm like right up in your girl.
So I'm just feeling the superior angle of her scapula because it's very prominent. Remember, she has winged scapula. I'm going to put her hand on her chest, adjust my mask, and I'm going to lift up and out like I'm lifting up her whole scapula because it's letting me get to where I want to be on the medial border.
With which hand?
Both.
Both hands, okay.
So right now, my hands are in her lamina groove on her right side of her vertebrae. I can feel where her border of her scapula is, but I haven't moved to it yet. Is this uncomfortable at all?
No.
So my fingers are just going to do this, but I don't have to hold up anything because she's just falling on top of my forearm or forearms and palm. So
That's awesome.
gravity is our friend. I mean, not as we age, but it is. So I have all of my fingers except for my thumbs. They're just hanging out. I'm on the medial border of her scapula. And because gravity is helping, her body is trying to fall down into my hand. And literally my fingers are just doing this, which is not any work at all for me. But gravity just helps it seem like it's, I mean, I'm feeling her rib cage, everything. Does it feel deep? Or I don't know if that's the right word.
Like, well, it feels effective. I don't know.
Good word.
Yeah.
So now I'm going to take my right hand out, leave my left hand in, and I'm going to lift up because it changes the sensation.
You're still moving your fingers?
Yep. So my thumb isn't doing anything, but it is resting. So by moving her arm, it changes her scapula. So it might make it feel more intense, but it's really just because I'm moving her arm.
Is that how it feels, Stephanie?
That's neat.
So then I'm gonna take my hand out and I'm gonna try to position her arm into either thumb up or palm up, because that's gonna be pre-work for the pec area. So normally during a massage, but we're not gonna move the camera right now, I would scoot my stool up to the top, add a little oil, and get to the other side. But for the sake of the camera, and I don't wanna move it, I'm gonna go the long way around. So normally I would just scoot around to the top and come over to this other side, and I'm gonna do the same thing. This is really getting loose. Whoop. My ear doesn't wanna hold it. Okay,
Can they see?
just gonna, yeah, I think. Trying to see. Does that hurt your arm?
What,
She
like
put that
this?
there for a
Yeah.
reason.
Well, it's just more comfortable like this right now. You could put it back. Do you want me to put it back?
Yeah.
Okay.
Which would be, so I wouldn't quite word it that way if my client was doing that. I might ask, oh, was that uncomfortable there? Or maybe they were snoring and they didn't even know they did it. Then I would somehow figure out how I can get back over there and do it back. Because some people, you know, we move in our sleep and we don't know it. So, but because she looked at me when she moved it. So I'm just reaching under, I'm lifting up her entire side body and scapula, which is really just leverage of my forearm lifting up.
How does that feel when she does that, Stephanie?
It feels really good.
Yeah.
And so I'm going to her vertebrae, and now I'm just resting there. And I'm just letting, sometimes people like hold themselves up because they're like, she's got her
Helping you.
hand sticking under me. So if that occurs, you want to just give it time to stop that. They can't hold it up forever, and you'll know. A muscle can only hold for so long. So now I'm just barely moving from her lamina groove over to her medial border. So I'm doing like this type of thing. Not, I'm working both hands, but they're not together. They're alternating. She does have a little bit of difference on this side. Tension below, deep to her rhomboids. So now I'm getting to that medial border. And I have my left hand, my fingers are like this, and my right hand, I have these two fingers sideways or up and down because they fit under the scapula that way.
And you're just holding them there, or you're moving them as well?
No, right now I'm just holding them. Every time she takes a breath, more gravity.
Julie, can you show that again? Because you were frozen.
Ah, darn it. So my left hand is doing this. And let me get my other hand under there. My right hand, I have the side of my index finger on her medial border, but both of my fingers are there. Oh, sorry. Don't poke the client in the head. So I'm just holding it on the medial border. And every time she takes a breath, there's more and more depth that my fingers go up into her rib cage, but it's just because she's falling over my hands. It's like if I put a boulder underneath your shoulder, you'd eventually just be like, all right, I'm gonna let go and just let it find a place. So now I'm gonna see if this works. Nope. So I'm gonna move her arm around to see if I can increase, and I can't keep her medial border. There's just too much tension in serratus. I'm trying to do what I did on the other side, which was increase it, but I can't. because it just won't separate there. Is this where your scar tissue is? Or is that the other side?
That's actually the other side.
Huh. Is that uncomfortable through there?
No, it's good.
Is your hand moving when you're moving her hand
I'm doing this with my hand that's underneath.
as you're doing that?
Yeah, and I'm letting her bones help me, but it's not the same as the other side, which is fine. But I'm still just working that medial border. I'm going up to the superior angle, up to levator, and then back down towards the inferior angle. So just up and down that border. So the client is very helpful, trying not to move her. I'm going to try to get you in a better angle of her neck. Okay. So when they have longer hair, I want to be aware of it. I'm going to try not to hurt it because I know none of us like it when, you know, our hair gets pulled. So I'm going to find clavicle, push down and out. Move this out of the way. I don't normally set my oil on the bed, but again, this is a little different. So the arms being out with thumb or palm facing up is opening to the upper pec area. So I want to find her clavicle, run my fingers lateral to medial or outside to inside. Just kind of let the muscle go underneath me or underneath my fingers. What does that feel like? Good, bad? Be honest.
Very good.
I really haven't felt the majority of these things that I'm doing, so I mean little bits, but so now we're going to do things a little different. I'm going to slide my hand underneath to try to get to the outside or lateral border of the scapula. And I'm going to pull up on both of her scapulas because I want to get upper trapezius and levator off posterior scalene.
You like this?
Yep, so all I did was reach underneath, find the lateral border. I turned my hands to hold it, and then I leaned my upper body back, and that was how I came up. So I've elevated both scapulas, so that was like a lovely way to do that without like pulling. And I don't, I think you can see right here. So it gave some extra, it increased the amount of the upper fibers of trapezius so that I could easily define it. So it just puts it in a position that is super easy. So I can easily feel that upper border or the outside border of trapezius. I can grasp it. If it was a person that was complaining of their neck having a lot of tension, by elevating that scapula, we've moved things around so that I'm going to push my fingers in to find the superior angle to get to levator so that I can pull that off and get to the second rib to get to scalene. So there's her second rib. I'm already there because I elevated the scapula. So I have both hands on each side, but I'm only going to start pressing in actually with my left because the right one doesn't have enough space yet. Can you give the crowd what that feels like?
I can't describe it. It's like it
Poor
feels.
Stephanie.
Yeah.
So now I'm starting to move my right fingers to try to get down into the superior angle of her scapula. And it's working. So I'm on her rib cage, which is very deep, but is it uncomfortable?
No.
But you know I'm there, but it's not hurting. So,
No, it's not like that one day in class when you were like feeling this.
so when you do it as a massage move, it's a little easier.
Yeah.
So her anterior and middle don't want to press down. I want to press to her feet. For me, that's easier with my second digit, but so I'm feeling her pulsing under my left index finger, but not under my right. So how intense is that feeling right now, Stephanie?
It doesn't feel that intense. A little bit, but not, I mean, it feels like I feel tension, but nothing.
You don't want to slap my hand away?
No.
I'm moving, my fingers are like too big to get where I want to get to. So I'm going to adjust her shoulders and see if that helps. So I'm going to go underneath her tricep, kind of press down, and then so I can get to like what I call like the catwalk thing. So this alternating pressing down on her shoulders, because I'm hoping that's going to allow some space between anterior and middle scalene. She doesn't know that. It's just a nice little move. I'm going to go back and see if it works. Oh yeah, that's much better. I like that better. I tell you guys, it's all about me. Thank you for adjusting your body so I can use my finger. Does that feel more intense?
It feels intense, but not like it's not uncomfortable.
So I have my forearms resting on the table. So I want to make sure that I don't have tension in my pecs or my upper back. And then I'm just going to do a little, what I'll call fluff on the back of her neck. We should be pretty close to time. I'm not positive.
We're past.
Ah, darn it.
We're 10 minutes ahead.
Well, we didn't start. Doesn't that say quarter after?
So 7:19.
Oh, I didn't think we started until like 10 after.
We did. Weren't we doing an hour? Or we doing
Oh, yeah, never mind. I can't tell time. There's that whole math thing.
It's not a requirement for.
You know, it's a full hour of work. So all I'm doing is going on the lamina groove from her upper thoracic up to the base of her skull or her occiput. I'm feeling her bone, so I know I'm getting deep. Is that uncomfortable at all? Is it horrible?
Nope.
You can grab with one and then go over to the other, although I got her hair on that one. And I try to end with the occipital hold. So my ring finger is going to be inferior to the bump of knowledge, or that external occipital protuberance. I want my fingers to be on her nuchal line. And once I have my fingers in place, I want to release the tension in my palms, my forearm, my pecs, my shoulders, because then that's just calming. Could you tell the difference between when I was like this and when I relaxed?
Oh yeah.
So always be aware of how you're holding your body.
What about when we have people turned and we're holding their head in our hand? when their neck is when their head is turned sideways.
So you've turned it or it's turned?
We've turned it.
Oh, well,
She
you
doesn't
gotta-
do that.
I don't do that. I don't do that. So you just have to figure out how to make a move out of it.
Okay. Oh, I meant should we be relaxed like that? I want to say I'm like gripping their head, but I.
Darn it. So I want to find the SCM without having to do that. So this is a way to do that. Now her head is moving slightly, right? But if I can, all I'm doing is identifying the muscle. I don't care if you can remember the name of it or not. You can feel this bulky muscle that is going from here to there, and it's at a diagonal. So once I find that, then I'm just doing this to it. And I already worked with the scalenes the other way. This, I mean, everybody has their own style, their own thing. You guys know that I don't like to turn the head. Part of that is my own issue. Even before I had surgeries, people would turn my head too far. They're like, oh, you're young. There. Oh, did you feel that pop? That was a chiropractic adjustment right there.
That was outside your scope of practice.
Wow. But they would do that. And I'm like, that's too far. It hurts. So sorry about that stuff. Hopefully the client is not going to sue me because of what I just did. But it always happened to me that way. And so I just adopted that. I don't want to do that. I need to learn how to do these things without hurting them.
Because he turns the head and then he goes down with his thumb.
When you guys know I'm not a thumber. I'm
Yeah.
not a pincher and I'm not a thumber.
Well, he says he isn't, but then he uses it all the time.
Yeah, and I see, there's me. So I try to figure out a different way based on the anatomy, just where it starts, where it ends, or the angle of it, or whatever it is, and how can I work it without having to do that. Again, that's just me. That's what works for me. But if I'm like in dreamland, I don't want somebody doing that either. Although it feels good and we're like, oh, they're moving me, but I don't know. They can twist my head off. I don't really care. But I want to try not to wake up their nervous system as much as possible. So that's what works for me. Well, I sometimes, people can have very large necks or no neck. So this technique works very well for that because I can just get through where I need to go.
Sure.
And especially if someone was complaining of neck or upper back tension, I definitely don't want to move their head because even if they're like, oh, it hurts when I drive or whatever, then I don't know. I don't want to hurt it even more or do that lovely adjustment
like
that she just did.
I feel like you got the SCM and stuff when I was face down too.
I did, yeah.
So
yeah,
and that was really fantastic.
Yeah, and part of it is I need to be efficient. In an hour, I've got a lot to do, which is why I'm not even outside of mask land. I rarely work with the face unless I have a specific issue. I mean, the hair massage, scalp massage, lovely. I don't have time for that. The hands, the feet, I'm sorry, they have to fall off the body. I don't have time. And people love that. I mean, they love their hands and their feet being done. And this morning, Cammy was like, oh, I love a head massage. I'm like, that's great because you're not going to get one. But because she had an issue.
Yeah.
So something's got to give. And there's nothing wrong with you saying that to your client. If they have a complaint of something and you're like, okay, it's going to take me a couple extra minutes in that area, you might need to say to them, I want to work really a lot on the area that you're complaining of your tension in, which is not necessarily where the pain is coming from, but we want to honor what they're telling us. So I might say, I might just do a little bit on your feet or a little bit on your hands. And they might be like, oh, that's fine. You don't need to do that or something like that. Or if they're like, oh, but I really love my hands and my feet massaged, then I'm going to say, okay, and that means I can't spend as much time doing what I'd like to do. So, or what your body needs. So I make them choose and let them know it's not that I'm skimping,
Mm-hmm.
but I don't have enough time. And the hour goes so fast
Yeah.
that you just don't have time, which is why I like the 90-minute, because then I can apply that extra time where I need it. But not everybody wants to do that. I think I told you guys last time, I've never done a 2-hour massage. I've done a 2-hour Thai body work thing, and that goes by like that. That's almost not enough time, but that's a completely different thing.
Are
So
we doing that next month? Like an
in
example?
September, and actually we talked this morning, we talked about because that's Linda's area, that we might do like a thing with that. So
Mhm.
we'll see what we can get worked out. But is your
No,
shoulder
I'm good.
bothering you? Oh,
No.
okay. All right, so I'm going to turn the camera. Ta-da! Yeah, I know this looks bad. But,
Julie, do you do abdominals, or is that like?
oh,
I don't.
I do, but usually only in a 90-minute. Unless I have reason, like I am, if you were complaining of neck tension, I would do abdominals because I need to release your diaphragm in order so that you're breathing easier, so that your scalenes can change. So it does depend on what your complaints are of, but on a normal, like you're pretty much normal, like I don't have anything that's bothering me. Yeah, I have tension, but nothing in particular. That would be my hour massage. I do abdominals when needed or when I have the time, but it's not on all of them. And I didn't. So Nicole and Krista, she's still on. So this morning I did Cameo's pecs and that area.
Mhm.
I did it differently tonight because it just depends.
Mhm.
Just depends.
When you do abdominals, do you do the circle thing, clockwise circle thing that Mike does?
Well, let's see if we can. I don't know. Might need to move it. So I actually do it through the blanket sheet, whatever, on top. You don't have to do that with your arms. You can do whatever you want with them.
Okay.
So, sorry, my tape is itching me. I need to find where her rib cage ends and where her pelvis begins, because I want to be right in between that. And then I'm going to move that into my direction, which really I'm just going to the bottom part of the rib cage. I know when Mike does this, I think he does it fast.
Yeah.
I love it slow. So that's just me. If I am going to do this, I'm going to hook my hand on right in this area. So it's kind of the outside of the iliac crest, but I'm going to push down on ASIS and pull up on the pelvis, or the lateral iliac crest. I just have to be careful not to
As part
push
of the
too
ab
much.
massage, you do that?
Yeah. So this is my form of ab massage. I'll get to the rest. Hang on. Don't rush it. So once I define where the ribs, where the space is in between, and the pelvis, I want to focus on the obliques over there. So I can push down on the rib cage, down on the pelvis. I can do the same. I can pull up. I usually hook my hands underneath as far as I can, and I get a little leverage and pull back.
How does it feel?
That's good.
Yeah, that's a good one. And then I can push down and up and do like a kneading thing there. So then when I wouldn't have the camera and the ball in the way, I would do my abdominal massage as I go all the way around, just changing my direction because my arm's not long enough to do it on her feet. And then I'm going to come back and I'm going to do the same thing. I'm going to push in enough and I'm moving her body so I can feel her bones. Doesn't matter if I know what I'm touching, I just feel bone and non-bone. I can do a little bit more of the rib cage. Maintain my circular motion. Prepare to do my little hooky. So I know you guys can't see. So I'm in like a reverse lunge. One foot is stretched out in the front. I'm pushing my butt back. So it's my body weight pulling. So it doesn't matter how big a person is. It's not my arms. It's my body weight. And I push down and kind of hook on the ASIS and kind of roll it around. I can sometimes do that when I get done with the leg. I might do the outside and come up and go right into the abdomen. Just depends on what they're complaining of or what I'm feeling at the time. So, but
Cool.
But that's a good question too. I mean, so it just depends on time. Everything is such a time factor, right? And when I can just like, have all the time in the world, which I don't want to, because then,
You'll just keep working.
I'll just keep working because I'm like, no, I want to feel this again. And, so, but any comments you'd like to give to the, which they can't really see your face, I don't think, but I don't know, maybe they can.
I was gonna say the forearm thing that she does is really great. I don't know, she's got a different way of working, and
I'm a weird one, right?
in a good way. Like that was really good.
What I said this, I think I said this after you left this morning, Nicole, is after a couple years of practicing, my wrists would hurt. And so I took time, because I'm aware of everything about my body. I took time to totally redo everything about my massage. Yeah, so that I'm using my forearm, and I only want to use these as little as possible. I want to pretend they're not there.
What
So
it feels
figure
good with the
out.
forearm. You're covering
It
a lot of
does.
real estate. It's just firmer.
I agree. Yeah.
You've got this flow thing that you do, and it's really great.
It's a dance. Bodies to develop yourself, and it's going to take a while for you to do that, which I normally say it's going to take about 2 years. And then you're going to be like, okay, now I need to take the time to look at at you as the massage therapist. What's hurting? What are you feeling? And how can you honor yourself but still take care of your client? And that takes a good 2 years of like, I just need to get myself moving and going, and because your brain is going to be full of stuff.
Well, even when we first start, I feel like, oh my God, how am I going to massage for like 20, 25 hours, whatever, a week when I give like, 4.
And that's, yeah. So for me, you will find a number that is comfortable, that's like your comfort of the day, like whether it's 2, 4, 5, 6, whatever it is. But if you get done with your work, whatever it is, maybe you do 1 and you're like, I'm exhausted. Is it mental or is it physical? Because in the beginning, it's going to be a lot of mental fatigue because you're thinking about everything.
Right.
What am I doing? How should I do this? What should I do about that? And is this good? Oh, or is this bad? So it's going to be a lot of mental. So you can't even pay attention to your physical because you're tapped out up here. And then it'll turn to physical because then you're like, So it all depends on how quick you can flow through that to be like, all right, I need to pull myself together and do what's right for me. Maybe it's your table height. Maybe, it can be a lot of different things. So I will tell you guys that up until we got shut down in March, I was seeing somewhere between 20 and 25 clients a week, right in there. Obviously some weeks it was more, some weeks it was less, but that was a good average. I was here 1 day a week, and then I would do clinicals at my other school. And I get energized. Like the more people I massage, I'm like, bring me some more. I need to play some more. So I know I'm doing it right because I'm not mentally exhausted. I'm not physically exhausted. I'm like, I need to bring me another body. I'm just getting warmed up, you know. But I also know where my limit is. I'm not going to do 5 a day because that's too much for me. 4 is perfect. So that's how, you know, that's just me.
Is that how you've always been, or like when you were at the hospital?
That was all different.
Yeah.
You can't, I mean, massaging at the hospital is, it was fantastic, but I could be there at 9 o'clock at night. I could be there at 6 in the morning. It could be midnight. I mean, it's just all over the place. So
Are you
it's
still doing
really hard to, not in the hospital right now, but with hospice.
that? Okay.
And I was going into the nursing homes, but that got shut down for right now. But sometimes the patients in the hospital, I'm in their room for 90 minutes and just trying to manipulate and go and do and, you know, like, and then other times maybe it was 10 minutes and then like that was all their body could tolerate at that time. I mean, it just depends on what their complaint of pain was and what medications and all that stuff. So I like it for that fact because you never know what you're walking into and you're like,
When it's different,
Right.
too, it's not the same.
yeah. So, but that's my preference. Hospice is a little different, but still people dealing with pain typically. So, and it is mental and emotional and physical pain all rolled into one, and you have to decide which part you can help with, because it is about pressure, but it's not. But it's also about, so the one client, she was going through stage 4 and beyond of 2 different types of cancer, but she was in extensive pain and there was no medication that was helping her. And she's at home and she's like, I just need to sleep and I can't get comfortable where my tumors are. And it was, and you're like, okay, I don't know how to even touch you is your first thought. Cause you're like, ugh, you got so much going on, but all she wants is relief. So you actually work harder to get like something so that she can just relax and breathe. That's all she wanted. She's like, I just need to relax and breathe. So it's actually more challenging than this is an easy work. So it's actually harder. And then we're empathetic because of the situation, but it's like you have to separate that out and be like, I'm just here to help this body right now. That's all I can do. I can't. So.
And then do they end up talking to you? Like,
Depends. It depends. But some clients talk, and that's what they want to do. That's for them. And other people, I mean, they lay on the table, and you might ask, you know, how's this pressure? Or you ask something, and they're like, don't even answer you, and you're like, are they sleeping or are they mad? I mean, what's happening? So, you don't know. So, yeah. Anybody have anything they want to ask or do, see, say, comment? I'm getting a drink. I'm behind the camera. All right, let me put my glasses on so I can see.
They're all gone.
Amy, because I can see you, was there a lot of interruptions in the recording or in the video feed?
Yeah, it would freeze sometimes and you'd get audio, or you wouldn't have you moving or audio.
I will make sure that my computer is updated before the next time. I'm sorry, I tried. It was unintended interruption there. I don't know. So,
Well, this morning was great. So, Amy, make sure you watch the one from this morning.
yeah,
Okay.
I will. I haven't had a chance to download that and put it up, but I will get to that. So, yeah, that one. I mean, and it's completely different. Not completely, but pretty completely different than what was tonight. Wouldn't you say? And Krista, wouldn't you say that it was definitely different?
Different, but similar. Yeah.
Yeah, some of the same moves, but just different. Yeah. So, all right. So Saturday, I can't remember some technique. I don't know. It was I think you said to Pope.
I think it's to Pope, man.
Something like that. And then next week, I'll be back with the body on the table. We're gonna do Trail Guide Chapter 4 techniques. So it's more the spine and the thorax, but I think I have to do a Lexer first, which is gonna be quick. It's talking about tables and bolsters, and I think it's Chapter 3 or something. So we'll do that quick, and then we'll get to work on the table. So I will make sure my good computer is correct, and then that'll be better. So, all right. Thank you guys. I appreciate it. Stephanie feels great, I think.
Thank you, Julie.
You're welcome. There's Stephanie. There's Nicole.
Thanks, Stephanie. Hi, Nicole.
Yeah, and thank you, Nicole, for being the camera operator. Definitely.
That's my part-time gig these days.
That's right.
Thanks. Bye.
Bye. Thank you.
Thank you, everybody. Good night.
Good night. All right. Go there.